So osteoporosis, when we say, it is calcium deficiency, and this happens in more commonly in women. Okay, so it is a condition characterized by decreased bone density. So what happens to a normal bone and what happens to an osteoporotic bone, we have to identify. And this, if not treated on time or if not taken care, can lead to fractures, which is a dreaded thing. So when we look at the worldwide incidence, it is a silent disease. It causes about 8.9 million fractures everywhere, and osteoporosis will affect 200 million women worldwide. So it is not just to India, to everybody else. And when we look at the incidence between men and women, men also have, but it is just 15 to 30%, and women it is 30 to 50%. They suffer more. And worldwide, when you see, 1 in every 3 over the age of 50 will have fractures. Let's not look at the incidence of the men, because we are more concerned with the women's health. The peak incidence in Westerners is a little late, between 70 to 80 years, because of their diet, their lifestyle. In India, it is more common because we Indian women are deficient in diet. And second thing is, the menopause is slightly early compared to the Westerners for us, because of the lifestyle and the kind of deliveries and the kind of the environment we have. So we Asians are small built, and in India it is even more common. And when you look at the osteoporosis in India, so it is definitely on the rise, but still we have to see that we take care of our patients. It is in the rise. I will tell you the reasons why. And let's not go into the classification, but just to understand what is osteoporosis. This is a normal bone and this is an osteoporotic bone. See how you see these black areas don't have calcium. That means the normal bone, when you look into an electronic microscope, you can see there is porosity, but the porosity is connected well. Whereas in an osteoporotic bone, it is unconnected and it is lots of lacunous areas. So osteoporotic bone is weak. So then there is something remodeling and how it happens. I won't go to all these details because we are not concerned with how the pathology happens and what is the peak bone mass. When I say peak bone mass in young women who are stronger at the age, between the age of 25 to 35, there is very good skeletal system and it is the bone density is good. But as they start aging, the risk of osteoporosis goes up. So how does it differ with the other women? That is, the current status non-modifiable. That means you can't change these things in life. A woman and alcoholism, of course, now we are women empowerment. We don't do the right things. We do consume alcohol now, and that also leads to less calcium absorption and osteoporosis. Poor health, inadequate physical activity, and recurrent falls, of course. They have to take care. As we age, we tell them we should not have those tiles or glazed tiles where women can fall. So we should have a rough surface. So this in older women, that is, we have an aged lady at home, and then we have all this kind of flooring. We have to be careful that they don't fall. So implication of osteoporosis, anywhere fracture, it can happen. The most common are hand, vertebral, and iliac bone. These are the common ones. So what happens? Early osteoporosis, what happens? Why we are so worried that it will cause a lot of pain? You can see your mother telling you, you can see your grandmother telling you, my mule ella now baratte. That is because of these weak bones. They get up, they sit, they'll have a lot of pains. Knee pain. We see a lot of osteoarthritis in the knee as women age, and they undergo knee replacements. Knee replacements are so common now. Initially, they would walk with a stick. Now we see women walking well. You should ask them, have you undergone a knee replacement? That's the lighter side of it, but it is more common. Now, why all these problems we have? Do you think osteoporosis It is just because of all of these environmental factors, inflammation, oxidation, hormones, and all those things. That is, physical activity is decreased. They don't have a healthy lifestyle. Smoking is increased now. You see more women smokers. Then alcohol intake is increased. Prolonged corticosteroid treatment. When there is a debilitating disease in them, corticosteroid treatment, if they take, then of course that also can cause osteoporosis. So, then why am I stressing so much on menopause? Look at the average age of menopause. It is 51 years. That means till then you should menstruate to have healthy bones, healthy cardia heart, and then all normal function, and not to age. Sometimes you look at the women who are 55, 56, and you say, my God, their skin is so good. That is because they still have their uterus. Though they are menopausal, there is some amount of hormone going on. Whereas in younger women, if they are hysterectomized, they age faster. Okay. So the changes I won't go to. What happens to the graph, I won't go to this. This is a little technical. And then what the calcium, what happens, the rate of bone absorption, don't, and what can early menopause cause. So that is when we get into problems. This early hysterectomy can cause a lot of problems. And the other important things which causes early menopause is of course, tuberculosis, and then some genetic disease, then diet. A lot of these models, size zero, them, they hardly take anything. They live on just sometimes liquid diet they go on. So yes, they have to do their profession as modeling, but later they suffer because their ovarian reserve goes down and they go for early menopause.